안녕하세요. 미국간호사 김미연입니다. 오늘 저는 저의 모교에서 가르치는 일을 마지막으로 수업을 마쳤고 드디어 학기를 마무리하게 되었습니다. 예! 무척 신납니다. 마음 같아서는 효과음도 넣고 그러고 싶은데 제가 기술이 없어서 그렇게 못하는 점은 참 아쉽고요. 다만 제 마음속에서 정말 큰 박수를 저 자신에게 보내고 있고 또 한 학기 동안 같이 수업을 들어준 많은 학생들에게 고마운 마음이고요. 또 무사무탈하게 한 학기를 마무리한 것에 대해서 굉장히 기쁘게 생각하고 있습니다. 오늘은 굉장히 바쁜 일정 중에 영상을 이렇게 급하게 좀 촬영을 하다 보니까 손으로 카메라를 들고 있기 때문에 좀 뭐랄까요, 흔들림이 있는 것 같아서 좀 아쉽지만 이해해 주셨으면 좋겠고, 항상 말씀드리다시피 정보 위주의 자료 또 정보를 공유하는 목적으로 제가 영상을 촬영하고 있다는 점을 기억해 주셨으면 좋겠고, 저도 저 자신을 상기시키려고 노력하고 있거든요. 이렇게 가끔 영상을 촬영하다 보면 글쎄 좀 더 멋있게 보이고 싶은 마음, 또 뭐랄까요, 좀 더 예쁘게 하고 싶은 마음, 그런 마음도 없지는 않지만 도저히 현실적으로 세 개의 직업과 거기다 엄마라는 직업까지 더해진 삶을 살면서 뭐랄까요, 조금은 무뎌지는 것도 있는 것 같아요. 그래서 다시 한번 말씀드리지만 예쁜 간호사보다는 열정적인 간호사의 영상을 본다는 마음으로 봐주셨으면 좋겠습니다. 오늘 학생들과 수업 시간에 이제 수업 내용을 가지고 촬영했던 영상을 짧게 끊어서 몇 개를 붙여서 올릴 테니까 한번 편하게 보시면 좋겠고요. 더 궁금하신 점이나 문의하고 싶으신 점 있으면 연락 주시면 좋겠습니다. 네. 오늘 이상하게 조금 긴장이 되네요. 카메라를 들고 있어서 팔이 아파서 그럴지도 모르겠어요. 팔을 좀 바꿔보겠습니다. 이렇게. 또. 네, 정리되지 않은 모습의 집을 공개하기에는 아직 저의 마지막 자존심이 허락하지 않는다는 점 이해 부탁드리고요. 지금 어디서 이 영상을 보고 계시던 오늘 하시는 일 즐거운 마음으로 하실 수 있었으면 좋겠고, 오늘도 여러분의 꿈을 응원하면서 영상 마무리하겠습니다. 당신의 꿈을 응원합니다.
To distinguish, this is a hypertensive medication, this is heart failure medication. They are, again, that's bad handing in. They work together, hypertension and heart failure. What's up with me today? Heart failure somehow doesn't come out very easily. So that's beta 1 blocker. Nobody put the brand, the actual chemical name of that medication. Do we know? Go for it, the future professor, Miss Savannah. Go for it.
I took pictures of the previous board, so.
That's hard to pronounce.
Metoprolol.
Metoprolol.
The reason why I chose that is because any of beta blockers are gonna have an LL at the end, so it's laugh out loud. If you're laughing at someone who has beta blockers, it's a beta blocker.
Like
That's how I remember
metoprolol,
it.
atenolol, like all lol ending are under that category, beta 1 blocker. So they all work as in a same principle: slower the heart rate, slower the blood pressure. What else? It's used for hypertension, chest pain, but not for the urgent chest pain, right?
What could a problem be with your patient if they're on this? Our specific patient? Any patient who's on blood pressure.
Wait, what was your question?
Well, what would you look out for? What could be a problem with them taking this? What could happen to them?
Sedation.
Something similar, but what made you think about sedation? Possibly like a heart rate slowing,
Yeah, maybe like you give too much and it goes too
Drops
low.
too low,
So
heart
it
rate can
becomes
go
very
too
cardiac.
low.
and then that creates lack of blood flow to the brain.
Absolutely, yes.
Causes confusion.
Yes. So let's say patient came to the ED. Here, ED candidate, listen. Patient 78 was walking on the street and just fell. And somebody called 911 and came to ED. You can check the vital sign first time, check the vital sign. BP is fine, maybe 95/62. The heart rate was 48. Heart rate was low of this elderly patient who fainted on the street, came here by 911 ambulance. You should be able to ask one question to this patient without knowing that we are going over beta blocker. Then what's gonna be your question to the patient?
What medications are you on?
That's definitely the part of that
Heart condition.
HNP. But do you take any heart medication, especially beta 1 blockers? Yes. If so, we are not going to give them medication right now because it doesn't do any good to you. Side effects, definitely dizzy, from the same reason we just went over. BP goes down too low, or heart rate goes down too low, and overall our body doesn't get enough perfusion. Then yeah, our body needs two things: oxygen and sugar. Glucose, yes. So keep it in mind. What else? What kind of side effect do you have with this medication? Dizziness.
Maybe weakness too.
Weakness too, yes. What else do we want to add on this? Move on to diuretics. Loop diuretics. We are missing a word loop on top of diuretics because it works on the loop of Henry. And diuretic has three different types of diuretics. One is thiazide type diuretics, and the other one is loop diuretic that pulls out potassium too, but there's a potassium sparing diuretics. So there are three different subcategories of diuretics. Seriously. And how many subcategories do we have of blockers? Alpha 1, alpha 2, beta 1, beta 2. So it's a lot. I mean, we didn't even go further down to ERBs and ACE inhibitors and nothing like that. But there are a lot. But if we know beta 1 blocker today and loop diuretics, that's two big medications that you're getting it done. Check it out. It can treat edema. Edema is a huge word. Heart failure is a huge word. Lasix has a lot to do with it. Loop diuretic is on the same category with Lasix and Bumex. They work kind of sort of the same. If you notice next time with a patient who's getting Lasix, sometimes they get potassium as a supplement. And you may question yourself, patient's potassium level, which is normal 3.5 to 4.5. Patient's potassium level is totally normal. Why this patient has to get 20 MEq of potassium once a day? Because Lasix, Bumex, they are strong diuretics that pulls out everything. So with water, the potassium gets pulled out too. Meaning that we worry about low potassium in the blood. What does potassium do to our body?
Like the
Does it aid in like
Yeah.
heart function or no
Mhm.
muscle contraction?
Muscle contraction.
Muscle, yeah.
So what do we worry about this? Heart failure
Muscle
here.
atrophy.
We need more contraction and we are losing potassium with water. So heart is not even working even better. Like, it has a lot to do with Lasix. But at the same time, heart failure has edema issue. We need to pull out water. And because it works fast, the risk can be shown and the side effect can appear much faster too. So we have to monitor differently from Lovenox. Again, Lovenox lasts longer, half time is longer, the time it takes from your system to be out of, it takes much longer. So it's more for maintenance and preventative purpose. but heparin is for more acute. So there's no love notes drips, meaning that the medication goes through your IV, but heparin drips, we hear heparin drip here and there. So that goes by drip, and we check PTT, APTT for heparin, and we check something else for love notes. What is that something else? The lab. One in your blood. That's a good guess, hematocrit, because it has a lot to do with anemic and blood bleeding factor. But no, that was close. Hmm?
Ooh, that's good.
What is it?
Albumin.
Albumin. What does it show to us?
Protein.
Albumin.
Protein that like helps like coagulate.
So that is a big indicator, big time indicator for malnutrition. If patient get abused, nursing home, let's say dehydrated, albumin will show the lower level in a lower level. So they need more nutrition. But this is about clotting cascade.
Platelets.
Platelet,
Very good.
bingo. So what is the normal rate of platelet?
I could tell you.
Yeah, nice.
Is it on here? 130 to
150 to 400.
Where is it?
Wait.
What? Where
Yeah.
do you have that?
That's normal. If the
I got one
platelet,
from Skills Lab. This girl gave me it.
oh my goodness. We can
Does
ask.
it have all the normal ranges? You can probably find them on Amazon.
Most. Yeah, probably.
Yeah, we should get some.
Mine's it just says blood gas coagulation and hematology, but it doesn't have like the rest.
So ABG,
Still nice.
CBC, CMP, things like that. So platelet has normal range. If it goes below 150, even the nurses, doctors say 150, 200. It's not really 200. It means 200 and 1,000.
Yeah.
C. diff, let's go home on time. My goodness, I think I'm failing. C. diff, contact precaution. Dehydration, yes, patient is pooping. The poop is not really solid at all. It's all watery. There's no formed anything. If you send a sample of the formed stool for the C. diff screening, they
They
will
will
throw that
see.
away. What are you doing? It has to be uncontrollable watery diarrhea. You can't even question. Just imagining that your face is like yeah, you still keep your smile. Diarrhea, watery, uncontrollable, smelly, and acidic. It's very sticky.
Oh, that was gross.
That's very gross. And contact isolation involves what to wear.
Gown
I would wear a mask though, in case.
Why
I
not? For
would.
C. diff patients, for your clinical practice.
I would.
I would wear one
Yeah.
because it
Spray,
hides.
anything.
Anything that helps you from
Yeah.
smelling that smelly
Yep.
poop, do it. But for book smart purpose, it's gown and gloves because it's contact. But droplet, airborne, definitely mask.
I don't know what to do because masks make me feel very like claustrophobic
Claustrophobic.
and
Oh,
I
yeah.
get like
Just
anxious.
gotta do it.
But like I also cannot like shadowing like the wound nurse. I needed to put a mask on because I'm like
Smells
I'm-
pretty bad.
so it's just like a lose-lose situation.
Yeah, your muscles and bones getting rotten up. It smells pretty bad. It's
Oh,
pretty
that is
unreal.
bad.
That's so cool. It's
Bad.
so bad.
So there
It's
we have a
cool to look
concern
at
about the
that smell.
moisture barrier cream and
Yep.
skin breakdown because this is watery, acidic. If the patient sits on it for a long time, it will get red and we will lose part of skin. If it's red already, that's stage 1 pressure injury.
Yep.
But we do not categorize, stage it, just make a consult to wound care nurse. Because all nurses have different standards somehow, and it's not correlating that hospitals have more issues than hiring one nurse who's doing it consistently. So we don't stage it. Clostridium difficile. I've never heard anyone saying the whole full term, but that's good to know. And C. diff, that's normal flora. It kills everything. So this is funny because people say that patients get C. diff because of antibiotics, and the course of treat is antibiotics.
Yeah.
Flagyl and vancomycin. What the heck is going on? So the problem is patients who were exposed to antibiotics for other purpose, other reasons prior to this incident happens, they have good flora all dead. It's all gone. So basically we're turning our immune system down in order to treat some kind of infection. For example, have you guys ever had any PO, any IV antibiotics for any infection? I had one time my acute pharyngitis. I just couldn't even swallow the spit. I had to spit it out. It's just so swollen, hard time breathing, and I got scared of it. What is it? So I went to the hospital and they said it's acute, pretty severe pharyngitis. So they gave me, I think it was azithromycin, 250 milligrams once a day. It's not even twice or 3 times for 5 days. Day number 1, after that 2 hours, my stomach started to growling, cramping, non-stoppable diarrhea. I'm like, what is going on? And I was definitely thinking about that word, CD, but it's too soon. So it was just a side effect of having normal antibiotics, the mild, well-working one. And I almost thought about stopping it on day 3 because I stopped my diarrhea and it got better. So I was like, it was very tempting, but as a nurse, I know we have to finish the whole course of antibiotics. Then 2 more days. I did it, but many people don't do it. Or they're exposed to different types of strong antibiotics, broad spectrum antibiotics prior to this incident happen again for any infection issues. So their body has less immune system to fight back, and it happens from GI. We all have some portion of this. 1 in 4 people have normal sedative flora in your gut. We are strong enough not to show that, but when patients are not strong enough with a lot of antibiotic use, they don't have that fight back energy. So that's the time they develop and make it appear with the symptoms. It often causes confusion because dehydration, infection is a big risk factor for elderly with confusion. If you are in a nursing home, you see a patient every day. This patient was okay yesterday, and today completely different person, very confused. First thing that you can consider is UA sample, urine and culture. Second thing, any infection ongoing, vital sign changes. And this infection definitely has something to do with a vital sign change and fever, cramping, loss of appetite. You keep pooping, you don't want to eat anything. It's not attractive. Spread the fecal. Yes, it's about GI. So again, oftentimes doctors give antibiotics, flagyl and vancomycin, and give probiotics. So you know why they give probiotics. Questions? Tired. That's a lot this time already. Okay, so we've barely about made it on time.